So a typical patient of the LCIA testbed programme will be around 70 years of age. They will have a long-term diagnosis of either heart failure or COPD, and they will be receiving technology in the home. So for patients who've got a very high risk of admission to hospital, they'll receive a Motiva tablet which asks them to send in their vital sign readings on a daily basis. These are then monitored by a clinical hub who contact the patient should the patient's readings fall outside of normal parameters. The solution also offers them educational videos on their condition and advice and guidance on what they should do should any of their vital signs start an alarm or suggest that there might be interventions required. Patients who have got a lesser risk of admission to hospital are having an SMS text messaging service called Florence, and Florence also measures their vital signs and offers advice should any readings again look like they're cause for concern. So if somebody's blood oxygen level is falling, Florence will give them advice on what to do in order to look after themselves in the home. We do stress to patients that these are not replacements for clinical interventions, and that should they feel unwell, they should contact their clinical teams in the normal way, but they are an enhancement to their care and are intended to help them to self-manage more. I think the vision for the future, judging on the feedback from patients, would be one of a more empowered nation. People who are more comfortable and confident in managing their long-term conditions themselves in their home environment. We've had some wonderful testimonies from people who've been more or less housebound prior to going on the programme, who now feel they've got the confidence to actually go outdoors because they know how to manage their condition in cold weather, for example. So I think that will be one of the wonderful things that we would see. So it will be spread and adoption throughout the local STP footprint, and possibly widen also to different client groups with different conditions. I think the possibilities are endless, really. Some wonderful news at Expo that there is going to be funding available for the next 2 years. How that is going to look and what that's actually going to mean for us, we don't know yet, but we're sitting back with fingers crossed and we're raring to go for any challenges that may come as part of that.